Those were turmeric, cinnamon, and cloves. They help relieve cough and also help improve our immune system. Now let's go to our doctor's discussion as he'll be telling us more on what tuberculosis is, symptoms, causes, and more.
Is a bacterial infection caused by a bacterial organism called it's called Mycobacterium tuberculosis. The organism basically is transmitted through droplets. Air droplets. When you cough and you release these droplets from someone who is harboring or who has the tuberculosis, the coughing, the sneezing, and even from speech, maybe singing and the rest of them, one can get infected when you're close to that person who releases these air droplets. It's actually a very common illness. It's actually a very old illness. It's more of a global burden. At some point, it went down, but the resurgence of immunocompromised individuals actually led to the resurgence of tuberculosis amongst us. It is actually a disease that you can ascribe to the environment. Usually it's environmental related, where you have a lot of overcrowding and of course having so many people living within a small space together. So, and then again, another risk factor to it can also be contact. When you have someone who's already diagnosed of tuberculosis and then someone caring for that person can actually, get down with disease. The symptom is also fever. There is what we call night sweat. So most times the person's infected will sweat at night. But a universal symptom is, a persistent cough. The person keeps coughing, and in a lot of situations too, the person will cough out blood. So we'll call it blood in sputum. That means you notice the sputum you produce will have streaks of blood in them. So these are some of the things that you notice, and then you can actually start suspecting tuberculosis, including weight loss. Cases of tuberculosis, you have a lot of weight loss too, and those things, once you put three of these symptoms together, then one can begin to suspect that, look, this might be a case of tuberculosis. One should actually go ahead and run the test to be able to rule out infection with tuberculosis. And there are 2-3 different tests that you can have. One of the very common one is called the Mantle test. There's also chest X-ray, which can actually show the lungs and see if there are damages to the lung that is, synonymous with how TB can present on the chest X-ray. And one can also, think that yes, this might be a case of tuberculosis. And there's also the normal ELISA test, which you run in the lab to detect the it's more like immunoassay to detect if the body has produced substances against tuberculosis. The organism can actually be looked up, under the microscope. So there's a direct observation under the microscope to identify the bacilli, the bacterial organism directly. So visual identification through the microscope in the lab can actually pinpoint that yes, this is tuberculosis, because you can actually see the bacteria within. That's one key method. or rather, these are the key methods that can be used to diagnose tuberculosis. Prevention of tuberculosis, the key stay is the vaccination. Usually, the vaccine is called BCG. CG vaccine is called the Bacillus calmette guarin vaccine, which is usually administered to children at birth, I think, after 6 months. And so it's, covers or prevents contracting of the bacteria or getting infected with tuberculosis. Other form of prevention would, of course, be public health measures, including decongesting where people stay, making sure that environment is conducive. You don't have so many people within one space. And other things that can also be done will be, because it's dependent on the transmission from one person to the other through air droplets. It's important that anybody identified to have tuberculosis must be treated immediately, because if it's not, then the tendency to transmit it to one person and to the next person is high. So it's actually a part of prevention, being able to detect early and treat that person early so that the person does not transmit this infection to a next person. Because the treatment is, there's what we call there's a short term, long term, the treatment that can last for 6 to 12 months or even more. Is usually very, very challenging. So there's what is called DOT treatment, which is direct observed therapy. So that means the person taking the medication must be seen to be taking the medication. So a health worker has to observe the person taking the medication, because if not, the person would probably skip, will falter, and default from taking his or her medication. And then those defaults can actually lead to what we also call multi-drug resistance TB, where the TB is now resistant to some of those drugs because you've not taken the drugs the way you should take them. And it becomes difficult to cure such form of TB, because drugs that the TB can easily be, and that can easily kill up the organism have developed resistance to them. So those things are actually very, very key to prevention. It's basically prevention and treatment together. So treatment, there are multiple drugs that are used, and we'll do the direct observed therapy, and there are different regimens, which I wouldn't go into. Regimens that one can, the short course that you can take for a period of 6 months, 3 to 6 months, and then there's a long course made up of different medication, and you could have up to 3 or 4 different drugs, antibiotics that can be put together to make one regimen, and the person gets cured after you complete your regimen. Normally, every drug has side effects. So when you say are there side effects, I would say yes. But the thing is, are there side effects that could cause more problem to the system? Yes, depending on the drug. Certain persons can tolerate some other medication, while some other persons will not be able to tolerate the same medication. So it's also important to identify a regimen that fits a particular person, and then that regimen will be administered to that person. Relationship between HIV/AIDS and tuberculosis. At the early stage, I think I mentioned it. Tuberculosis affects people that are immunocompromised. When we say immunocompromised, their immune system is not optimal as it should be, and such persons could be people who are taking certain medications that can suppress the immune system, where it is called immunosuppressants. Then others are maybe diabetic patients, because diabetes also affects the immune system, and people who are living with HIV AIDS also suppresses the immune system. So because the HIV suppresses the immune system, it makes it easy for tuberculosis to infect people who have HIV. So the resurgence of TB actually came up when HIV became a bit rampant. You now had a lot of people coming down with tuberculosis. It's also important to point out that when I talked about the latent TB and the active TB, a lot of persons have latent TB and can actually live all through without the disease becoming active because they are healthy, they have their immune system, so the immune system has taken care of the TB, but the organism is still there because it's actually very difficult to kill off or to die off. So it's still there, but the immune system takes care of it and it's not active. So anything that can reduce the immune system, including HIV, that person can actually come down with tuberculosis. Transplants, most times when you have organ transplants, immunosuppressants are used to prevent rejection of that organ because it is the way the human body is. If you have an organ or anything that's coming outside the person's own system, so it's foreign to that person. So even if an organ is taken from another person and put into another person, that organ is foreign to that person. So the body system has a way it functions. So it attacks that organ as if it's a foreign body and probably destroys the organ. So in order to prevent that from happening, persons with organ transplants, immunosuppressants are usually given to them so that their immune system is low. It doesn't start fighting back or attacking the organ. And in such a situation, they also become exposed to diseases like tuberculosis. But of course, if all precautions are taken, they are not exposed to persons that are suspected to have tuberculosis and all that, then it's not likely that they will come down with tuberculosis. Yes, TB is important for lifestyle modification because we've talked about staying in crowded places, in halls where there are a lot of people, then smoking, alcohol intake. It's important because all these things also have their impact on the body's system, especially the immune system. So it's important for one to control those things that can affect the body, the lungs, like smoking. And then, of course, other exposures, yeah. Very key advice would be one, overcrowding. As much as possible, make sure there are standards, yes. As much as possible, make sure that we don't have multiple persons staying in a very small space because we don't know who has the uh, disease or not. So overcrowding is important to also keep our buildings well ventilated. Where you have very good ventilation, then it's difficult to just have the droplets circulating within the room. If you have cross ventilation, it's a lot easier and better. So the style of our houses, good ventilation, very, very key. And then, of course, as much as possible, care for ourselves, especially when we're taking immunosuppressants. And of course, those advice would certainly come from your doctor on how to manage your health when you're taking immunosuppressants and drugs that can bring down your immunity so that you do not contract other diseases that go with immunosuppression, like tuberculosis and of course, when also somebody has contracted, let's say HIV, the person should also modify lifestyle. It's nutrition is very, very important and key, and then avoid excessive alcohol intake, and also smoking. These are things that can actually affect the immune system and the general health of a person.
Understanding the causes, symptoms, and treatments straight from an expert makes the difference. So if you have prolonged cough, unexplained weight loss, or other concerning symptoms, quickly see a doctor to ascertain whether it is tuberculosis or not. Now let's go on a quick break as we take some health tips on tuberculosis. Those were some valuable health tips on tuberculosis. Simple yet powerful steps to protect yourself and those around you. Now let's continue our discussion and explore more on this important topic. Up next is our Did You Know segment on tuberculosis. Tuberculosis is one of the oldest diseases. Now you know some facts about tuberculosis. We'll go on a quick break, and when we come back, we go for our question and answer segments. You're welcome to an interactive segment where we take your questions, comments, and suggestions. And of course, if you're just joining us for the first time, you can also be part of this by sending your messages to the numbers displaying on your screen. Our first question today is from Mabel James. She states that she's a new mother. Congratulations. She said, please, can you direct me on how best to position my baby for breastfeeding? I'll be grateful because I am having a difficult time handling it. Well, Mabel, here is a clip that will help you, breastfeed your baby comfortably. Welcome back. Hope that clip helped you, Mabel, and a whole lot of you out there that are finding it difficult, to comfortably breastfeed your baby. Our next question is from Musa, and it goes, good day, presenter. Please, can you get a psychologist to talk on how best to overcome personality disorder? Well, Musa, here's our doctor's reply for you.
Well, you've seen a therapist or you've seen a psychiatrist and they've arrived at what it is that you're dealing with. In cases where the person is dealing with more than just the personality disorder, maybe they have anxiety, for example, they might need to be on medication, and that would be done by a psychiatrist, right? So sit down and have a conversation and determine what medication works best, and then obviously there'll be frequent reviews to determine the effectiveness of whatever medication they are on. The next one is psychotherapy, which is talk therapy. And so essentially what that is that you're going to be sitting down with a psychologist or a psychiatrist and having conversations. And so the idea behind psychotherapy is that you are looking into the person's past experiences to determine what are some of those things in their past that have influenced where they are now. And so people would usually begin to explore their childhood and explore things that have happened in their lives that could have had an influence on them, because it's important to note that there's a lot that happens in someone's childhood that has an influence in how they are.
Welcome back. Those are all be taking on our question and answer segment for today. Do endeavor to send in more questions, and our doctors will be right here to answer to them. Let's go on a quick break. I'll be right back. Welcome back. Today, our focus was on tuberculosis. Tuberculosis may be a silent threat, but with awareness and the right medical care, it is preventable and curable. Remember, your health is in your hands. Don't ignore the signs and always seek medical advice when in doubt. Thank you for joining us on Your Health Today. Until next week, do stay healthy and stay informed.
Old school